Good evening to all our followers. Thank you. Please, I'll just allow you to join this live before we start with the discussion regarding the COVID-19 situation in the country. Please join the live video before we start with the discussion regarding the COVID-19 in the country. I'll allow a little bit more people to join the live before we start. Hello, Maninya. We have Maninya Dambel right here as my co-presenter. We'll be presenting the COVID-19. We'll be having a general discussion regarding the COVID-19 situation in the country together tonight. Maninya, can you hear me?
Yes, I can, Bintou. Thank you for having me.
You're most welcome, dear co-host. We'll just allow a little bit more people to join the live video before we can start the discussion. Okay, I think as we are used to be doing it these days, and since the past weeks, I would say, we will just start by announcing once more who we are. This is a platform called COVID Gambia. This is a platform that we've put in place as a group of concerned citizens who just thought about what to do to help during this pandemic. And so we started this COVID Gambia initiative couple of months ago, and since then we've been engaged in various initiatives, and one of them is to share valuable verified information with our followers, because it's very important for people to get reliable verified information on one platform, because we see that lots of information are being posted around, so it's very difficult for the general public to really know which is which, and to really know which page to follow to be able to have accurate, verified, constant information regarding the COVID situation. So this page is mainly about anything pertaining to the COVID situation in the country. We try to gather information from various sources, from our colleagues in the media, from international organizations, from the Gambia government. And whenever we have anything relevant to say, we come on live and share those information with our followers. We also post on daily basis any valuable information that we come across. We post it simultaneously. As soon as it comes out, we would just access it and post it online for the benefit of our followers. So this is what we've been trying to do for a couple of weeks now, and we try to be constant at it, even though, I mean, we are all involved in various in our various work and engagements, but this is a national call, this is a national duty, so we feel that we are all responsible, and we all have to take responsibility during this health crisis. So like we are used to do at the beginning of the live videos, we're just going to start by announcing the figures of the day, the figures that have been received today. And as we've been mentioning it these previous days, the figure seems to be a bit backward in terms of dates, meaning that the figures that we're announcing today are the figures that are released today, but let me check when they were actually collected. I don't know if I have that information because it's not appearing. Let me see quickly. I just have to verify when those figures were collected, because they were announced today, but the figures are actually from Yeah, the figures are actually from the 11th of August, meaning that these are the figures of the past 2 days. This is the figures that have been collected the past 2 days and are reported today, meaning that we are 2 days behind in terms of announcing the figures and in terms of receiving the accurate figures. We are still waiting for the figures of yesterday and today. So I'm sure that tomorrow we'll be receiving today's figure. This is how it's been going on with the health ministry so far. Okay, so just to announce the figures of the day, there is 79 new cases in the country. As out of 184 tests conducted. Out of 184 tests conducted on the population, there is 79 that came out positive. The total number of cases as we speak, the total number of active cases as we speak is of 1,246. This meaning that there are 2,246 people who are carrying the virus and who have tested positive so far. Out of which you have 267 that have recovered, meaning that out of 1,556 cases, confirmed cases since the beginning of the pandemic to date, there are 267 people that have recovered. And out of that, meaning that we have 1,246 people that are still living with the virus and that have tested positive. So these 79 cases are an account of 184 tests that have been conducted on a certain number of people. So it's important to mention that the tests are not being carried cross-country, meaning that it's not the tests are not being conducted on the entire population. As we speak, there is just certain people that are being tested. The samples are being collected from certain people. I don't know exactly how the ministry goes about it, but this is the figures that they're coming out with to the public. And to know more, I guess that we have to be either following the Ministry of Health's page to try and understand how they collect these samples and how they try to identify the people that they test and what are the criteria. This is important to know. Manyinya, over to you regarding these figures.
Wow. Bintou, first of all, I'd like to say thank you for having me. You guys are doing an amazing job. It's a great initiative. So well done and bravo. Whenever I hear these figures, I just panic. Reason why I would panic is because, like you said, the figures were from what, 11th? The 11th?
Yeah, 11th, yes.
So we've got like a 2-day delay.
Yeah.
So we've got a 2-day delay. So basically in 2 days' time, I'm just speechless. What are they doing with regards to the testing? Because you mentioned something about the testing. Are they still testing regularly, or what's the situation on the ground at the moment?
I mean, due to what we understand, what we are made to understand is that like we know, many of the frontline workers have unfortunately caught the virus, and some of the hospital workers also. So which makes the health sector a bit weak in terms of capacity. So we want to believe that it is due to these shortcomings and these unfortunate events that the capacity of the health ministry has greatly reduced, and that they don't have the capacity to actually collect or conduct the tests as effectively as it should. And that could be one reason explaining the delay, or it could also be that they're lacking test kits, or they do not have enough people in the labs, or there's a delay because there's also some people that mention the NAWEC issue. We heard the laboratories where the sample are being tested that also reveal the fact that they're experiencing some power cuts that is delaying their work also greatly. So I don't know. I think that this can be some of the shortcomings that are preventing the health ministry to perform up to expectations in terms of collecting samples and getting them tested and information or results coming out as fast as it should. I mean, according to my own understanding and maybe analyze of the situation. But obviously, it will be interesting to hear from the horse's mouth.
Absolutely, absolutely. As a private citizen, it is quite scary to know that there is a delay with regards to, the figures. Because if you're telling me 11 days on the 11th of August, that's what the figures were. But what are the figures today? Yes, there are delays. Um, when it comes to this situation, to be honest, I know we are not doing the finger pointing thing, but we need to get our act together. I don't know how that's going to happen, but people also just need to take, just take responsibility, individual responsibility. I've been echoing that for quite a while now, that people need to stay home, wash your hands, and do what WHO is asking you to do. And just follow the guidelines. Do what your health ministry is asking you to do as well. It's really important. But yeah, What was the next one that we had,
Why
Bintou?
I mean, one thing that I wanted to point out here, Maninya, it's not very easy for the population because this is a new situation for everybody.
Yeah.
Before everybody understands the magnitude of the situation, knowing that we are a population that is not so literate, it's very difficult for people to get messages as raw as they are being put across, so obviously I won't say that it's normal, but we could have anticipated that the population would be lacking behind in terms of some of these preventive measures that are being announced constantly. And one thing that is important to do is to constantly remind the public that is being done. There's a lot of sensitization being done on the ground, and I think that we should not relent on when it comes to sensitizing the general public. And that's why during all the lives that we do, we usually ask the followers of this page, and hoping that this page is going to be shared widely so that everybody can be transferring this information to their families, relatives, even if you are abroad. I mean, and you're viewing videos or you're coming across messages that are messages of prevention, and you know that some of your family members might not get access to some of those preventive measure information, make sure to just discuss with them and let them know. It's very important. We need to be a relay to our fellow Gambians in terms of sharing information, especially important information, reliable information that can save lives.
Absolutely. In this situation, word of mouth is really, really important. We need to
Absolutely.
do, as you just said, we need to speak to them back there. We need to inform our communities. We need to do what we're doing now. So it's not just like we said. It's what did you call it? A national. You said something in the beginning
It's a
about
national responsibility. It's a
national
patriotic
responsibility that
responsibility.
we're taking. So it just doesn't have to be the COVID Gambia page. It can be everybody. We need to speak in different
Absolutely.
languages. We need to let the communities know how serious this is. This is no joke. And the figures
Absolutely.
that they're getting, they're not even the right figures because these are figures that came out. What's the date? 11th. Did you say 11th of August? So
Yes,
it's
2
11th of
days ago.
August. So now we've gone, what, 2, 3 days later? What are the figures going to be? So we need to make sure that we're sensitizing. We need to make sure that we're doing programs like this and speaking to individuals and letting them understand that this situation, COVID, is real. COVID
I
is
mean,
no joke. People are
yeah.
dying.
My
Definitely.
worry with these figures, after being with COVID Gambia for quite a while and analyzing information and also coming across various type of information, my worry with these figures that are coming out is that they are not really representing the reality on the ground.
Exactly.
Because since
Exactly.
it's obvious that they're not representing the reality on the ground.
Yeah.
The testing, as the health ministry indicated it, are being conducted in the Greater Banjul area for now. The ministry does not have the capacity to conduct this testing cross country, meaning that there's lots of regions where no testing is being conducted there. We have no clue of what is going on in those regions. So we are not talking about figures that are representative of what is going on a national level. We are talking about
About just
figures
the
that are being
Bantu. So you
collected,
are
yeah, in the
saying,
Greater Banjul area. Yes.
so basically what you're trying to say is those figures, are representative of what's happening in Banjul?
I mean, I think the ministry, we can only get that clarification from the ministry because, again, in Banjul, in the Greater Banjul area, I mean, which area in the Greater Banjul area, that is not really specified on the reports that we've been getting. So we don't know exactly if it's in the entire Greater Banjul area or in a small portion in the Greater Banjul area where different
And are they
cases have
telling
been
us? Are they
happening.
telling us what areas are more infected? Are they telling us that there are more cases in the Banjul area? Are there more cases in the Serekunda area? What areas are being tested more? Are they giving that statistics as well?
Yes, I
Instead
need
of
to
just
go
telling
back to
us,
the
this is the
yes.
bulk, this is how many people have died, this is what we've got, this is what's happening.
I need to go back to the archives, but there was a report that came out indicating the number of cases per town in the Greater Banjul area. I think you might have seen it also. Like it was a sort of map where you could see in different towns in the Greater Banjul area the number of cases that had been reported. So we saw that Brikama, for example, was experiences a surge in the COVID-19 positive cases, and that's what I can remember because the figures that I have seen coming from the Brikama area were quite alarming. So for Brikama, I'm sure of it, but when it comes to the other towns, according to the map that came out, we can see that the entire Greater Banjul area is affected, but it varies per town. Actually, the figures varies per town. Yeah.
Yeah, I think it would also help. I'm not sure if the ministry is watching, and I'm no expert, but it would help for people to know these things, just to know what areas are more infected, where the surges are happening, and that sort of thing, because it gives people a greater perspective so we can understand better what the situation is and what needs to be done. So
Yeah.
communities can come together and do what they have to do to help themselves as well. But yeah,
Absolutely. Well, I think at this stage, even if a community is less affected, the general behavior should be a very cautious one. People
absolutely.
have generally to be very cautious. Even if your town is not marked as a highly infected one, you still have to be very cautious when it comes to all the preventive measures that needs to be applied. You should be respecting those measures to ensure that you protect yourself because you have no clear information as to how the virus is actually progressing. So
Yeah.
the one
I think
message
that
that
the
we
reason
keep.
the reason why I've said that as well, because it's been hard. I know the curfew is what, from 10 o'clock till six in the morning, and I think that would also help to deter people from going to visit from one place to another. Going to Banjul, them city Ainboka or whatever else. So I think that would also help in some instances.
Of course, yes, that will help, I believe. I mean, information is power. Information
Absolutely.
is key, especially in time of crisis. People need to have data. People need to be informed. And the information that we're getting from the health ministry, we expect it to be coming regularly and as frequently as possible. We expect the authorities to communicate with the general public as often as possible because this is the only way the population can be aware, alert, and also prepared to apply all these preventive measures that we are asked to be applying. But if communication is not really flowing, of course, people will start lacking in applying some of these measures, and then you can expect chaos to happen, which we really pray does not happen in our small country.
Absolutely. Absolutely.
Yeah, well, I mean, let's move on from this figures section and go to the information that we've seen circulating around social media and other platforms, information that we think are important to mention. We've
Yeah.
seen that on the Fatu network, there was an article that said that deaths now stand at over 40 as 10 succumb, out of which 7 are men. What does that tell you, Nyenya?
Wow. Out of which, could you repeat that again, please?
The article says deaths
At
now
over.
stand at over 40,
Yeah.
as 10 succumb, out of which 7 are men, meaning that this latest report states that there are 10 fatalities, 10 people lost their life from COVID-19. This is what the latest report indicates. And seven of those out of those 10 are men.
Are they trying to say that it's affecting men more now, or because I think it's affecting everybody, isn't it? I think we have to take every death very seriously. Um, you know, when I look at these figures and I think about how things are at the moment with regards to the way we're getting the figures and all of that, I feel like we need to be very careful with the way we're doing our reporting as well. Do you know what I mean?
Mm-hmm.
We have to be very careful because I think there was a time here in the UK where they were saying that it was just people over a certain age or just male that were dying. And then I think what happened was the ones under 25 felt like they were invincible. So they could just go out, do parties, and do whatever, just felt like it might not affect them. Until
Yes.
when they started seeing that they too were dying, then it all kind of like calm down. But it is an interesting story, and it does give us figures, and it does let us know that it's obvious what's happening out there.
Indeed, yeah, indeed. Like you said, we need to, I mean, we keep on saying that during all the live videos. There are lots of information circulating around the different WhatsApp forums, there are different information circulating on social media. Some of them can be very misleading and can easily cause chaos, be a source of chaos in the country. So it's very important for anybody reporting an information to be very responsible in how they share information
Yeah,
and to always verify the source. That's something that we learn. I mean, in
I'm sure they
schools
would
and
agree.
everywhere, we need to be very responsible.
Yeah, absolutely. I think that needs to be looked at as well. But I'm sure with their report, they would have absolutely looked at it. But my point, what I'm trying to say is when we start emphasizing on how many men, how many women, and what age and that sort of thing, some people might feel like they're invincible. Some people might feel like, oh, li gori rek la mo dal, li jigeni like, li age
Wow,
like, li lila, you know. I think we need to put out there the seriousness, especially within the Gambian community. We need to understand how serious this COVID is. Amud mak amud ndaw amud ne yangi 25 and you're a spring chicken, amud ne yangi 50 or whatever, because most people
absolutely.
now are having this understanding thinking that it's just the older generation, those with underlying issues and that sort of thing. No, COVID is very real. Regardless of who you are, when you're infected you have a risk of dying. It's as simple as that.
Absolutely. Absolutely. And I think that's something that you should overemphasize because that is very important. There's lots of misconception regarding this COVID-19, especially in our country. We heard in the early days people saying that COVID, yefi tubabla, tubabu kuolang. COVID is not in Gambia. COVID amut Gambia. COVID mantara Gambia yang. You know, those kind of things. People have been speculating, rejecting the existence of this COVID in the Gambia. And I'm not saying that this is what has caused the escalation of the virus cases in the country, but it has contributed greatly in giving a way for the virus
Absolutely.
to really take a proper seat in our country. So it's very important to deconstruct, I would say, all this misconception. And we can only do that through engaging with the public, discussing, sharing valuable, verified information, you know. And I think the media is doing a great job in that sense. You have lots of platforms like the Fatu Network, Kerfatu, Paradise TV, and you name it. All of them are constantly working towards trying to bring out relevant information for the public in various languages. And this is really commendable. And I think that
Absolutely.
the COVID Gambia platform is just adding its voice to what is currently being done by the other big media houses of the Gambia. And I think that this is the only way to try and put across important information and also deconstructing all the misconception and rumors that are going around. Yeah.
Yeah, absolutely. I think it's very important. And yeah, it is very commendable. I have seen what the media in the Gambia are doing with regards to this. Everybody is hands on deck. Everybody is doing what they can to make sure that they're sensitizing, educating, and doing everything it takes to make sure everybody understands how serious this virus is, you know, and that's how it needs to go. So I commend all the media houses in the Gambia and what they're doing. I commend the fact that they go out as well when the curfew is on to show people that yes, people are listening to what's happening and people are staying at home. Obviously, you would have some other individuals that think they okay, they can just do whatever they like, but they're also being dealt with by the law and with
Authorities,
the
yeah.
authorities, and they're
Yeah.
paying their fines and whatever. So we
Mm,
need to show because, like I always say, there will be somebody who would watch Cartoon Network and will not watch COVID. There's somebody who COVID Gambia, your page. There's somebody who would be watching this page and will not watch there. So we all need to do this. We all need to sensitize. I am not going to get tired of it, to be honest. This is my third one I've done, third platform I've come on. But I feel
yeah,
like we need to speak up. This is something that is so serious. And if it affects one person, it affects us all. And we see how
absolutely.
quickly people are dying. And that's the scary part of it. And it's not just older people are dying, younger people are dying too. And it's the young people who would go to these okay, now they've not been doing that because it's 10 to 6. So can do one of them club or party or whatever else. So people are staying at home and we need to continue this. We need to make sure that we fight this virus. It's going to be here for a very long time, to be honest. And don't let the vaccines that they're talking about fool you. Still take responsibility and still be cautious.
Yes, I mean, that's a very important point to make. Still take responsibility, know that you own your life, and that no matter what measures are being announced or put in place, you know the value of your life better. So always make sure to protect yourself and protect yourself from this virus, as you know that it is in the Gambia and it has already caused lots of fatalities, and those fatalities are being reported on daily basis and people are hearing about it. So I think it's an individual responsibility also to care for oneself and protect ourselves, like wear your mask when in public, always make sure you wash your hands whenever it's possible, apply the social distance, and then also respect the distance between yourself and other people, especially when you're talking to people. Do not be in their face like some people do, coming close to you and talking in your face. That's something that you should refuse. Always take some few step back to make sure that nobody speaks in your face, even if they're wearing a mask, because as we know, masks do not protect you
No,
100%.
no,
Okay.
it doesn't. It doesn't protect you at all.
Yeah.
Masks do not protect you 100%. I think, you don't have to be rude to the individual, but you have to sensitize. That's your opportunity as well. If somebody comes and stands in your face and they're not following the guidelines, all you could do is sensitize that individual. So that's your time to take that responsibility, speak to that individual, and tell them what you know about the disease, why you are being cautious. Because if you
Absolutely.
do that, you've educated someone, you've
Yep.
sensitized someone. But if you're aggressive, obviously that person would want to attack you back. So let's just be careful how we're doing this and how we're sensitizing each other. We're all in this together. We're all in this together.
I mean, whereas the government has clearly stated lacking capacity in terms of some of these things regarding the medical things and other facilities, I think it's important for us to realize that we are not fully protected and that we should not expect to be protected by the government. We have to know that this is a collective effort. This requires a collective effort and an individual effort to be able to protect oneself. You do not expect others to protect you. It starts with ourselves. That's all I have to say in that sense. And I think that we're going to
Absolutely.
move to the question sides, because we have some people waiting to receive some answers. I'll start with Selector Charles because he's a keen follower of our page. I think that we see Selector Charles almost every evening, and we thank you so much for this, Selector Charles. It's very important for us to make sure that we are making sense with this type of program, and that we are also making an impact, and that we're having people who are following us keenly, because it takes a lot of effort to come up with this type of program. People might not know all the background work that we do to be able to come online on air to present these live videos. So thank you, Charles. I will read your question for the public, for the followers to know exactly what you're asking. Selector Charles is saying that I'm back again. Hello, back again. Yeah, thank you for being back again. I know the central government has the regulatory oversight and protection of the rights of her citizens. My question to COVID Gambia, do you really know how many staff are working by the 1025 hotline number? I think the health ministry needs more staff so that people can reach the hotline number. It is really sad people are not reaching the 1025 number. What I have to say, if you can allow me, Manya, to start to give
Sure,
an
sure.
answer, that sense. Okay. What we know about this 1025 number, and I think I've been saying it before, but what we know as of today is that yes, the 1025 it's a hotline number that has been issued by the authorities for the general public to contact it if anybody is feeling any type of COVID-19 symptom or worried about some type of symptoms they do not understand. They have access to the 1025 number where they can talk to a health professional or frontline worker who would be explaining to them what steps to take. Okay. But
Yes.
it has come to our attention, and I think we've seen also the information circulating around the social media that the 1025 is faulty. The 1025 is not working properly. The 1025 rings, but nobody picks up. There's different negative information coming out from the ground regarding this 1025 number. After trying to find out from the authorities, what we got to understand is that yes, the 1025 number has gone through some technical issues, and then the government invited the public. Members of the public sector to help them solve some of these technical issues. They've been working at it. The 1025 is working, but it's true that it's going through some issues. So it's not fully operational as it should be. But the health ministry has also issued other numbers that can be contacted in case of emergency. We have posted those numbers on our COVID Gambia page, and the numbers are also accessible via the health ministry's page. So I think it's very important. Maybe we should just do a reminder about that. But this is what we can say in that sense. And I hope that my
With
answer
regards
helped.
with regards to the number, Bintu, I
Yeah.
wish I wish one of the viewers can just test that number right now, because now I don't have access to my phone to do so. But I wish we could test the alternative numbers to see that they too are working, because it's very scary. Let's say, for instance, it's just scary knowing that you're at your home, you have symptoms, and you've been given a number to call. You call that number and nobody is picking up. And I think sometimes it's just the panic that sets in. When you know that you definitely have this and you want to speak to someone, you panic. Lolo rek mun na la rek. So we need to make sure that these numbers are working, even if they are going
Uh,
to have the numbers of people who work in the ministry. Yeah, give those people's numbers out, and then you can call them direct and speak to them. Because do number Yahoo. This is a very serious situation
mhm.
where you have been given a number to call and that number is not working. And yes, I can understand. They're asking the public to come and help, or the private institutions or whatever else. But then Corona is not waiting for anybody. Corona Haruken. So we need to make sure that those alternatives numbers that they have given are working too. And I wish we had someone who's in Gambia right now and listening to this program or watching this program, so they can try that number two and see if it's working. Because also, Tamit, I can understand the ministry. They've got so much on their hands, to do. But I think it's okay. It's good also for public to job feedback. And they can understand that certain things are not working. You're putting things in place, but you're putting it in place for the general public. So you need to start also listening to the general public, to what they have to say, take it as constructive criticism, and don't take it as pointing fingers, because
Yeah,
we are all in this together. And the
absolutely.
general public as well will get scared and will want to call, because if you're in a home where for parent young papa and something happens, who do you look up to, Bintu? You look up to your parents. You look up to say, okay, what are we gonna do? What is the solution to this problem? And it's the same thing. In this case, the
Mhm.
general public, we're the kids. government and the ministry or whoever else are taking care of this COVID thing, they're the parents, and we will look up to them.
Absolutely. I totally agree with you. And I think that this is something that COVID Gambia tries to do also. That's why we constantly invite our followers and the general public to let us know, send us feedback, let us know anything related to COVID Gambia, any positive thing, because there's also positive things happening. Hopefully, anything that they see is positive. Like some people have been writing to us telling us that across the street, they've noticed that more and more people are wearing masks in certain areas. In some areas it's still lacking, so those type of feedback is still very important also to note. And when it comes to sending feedback to the health ministry that we are collaborating with, in fact, COVID Gambia is partnering, is collaborating with the health ministry. So we are constantly trying to also reach out to them when we have a question or when there's some concerns from the public. And this is something that we will continue doing because, like I keep on saying, we are not health professionals, we are not members of the government. We just obviously collaborate with the government, and we also collaborate with health professionals and anybody, any entity, any institution that is doing some work regarding the fight of the COVID-19 in the Gambia. So any trust us that any relevant query or any questions that you might have or any concern, we will, if you let us know about it, we will send it to the right authority. This is something that we've been doing and that we'll keep on doing going forward. Yeah, so we move on to another topic. Thank you for joining, Omar Njai. Thank you, Alima Salma. Thank you so much for being here. Amadou Skatrejane, Yamu Matar Sala, and our darling Fatoumata Rahman Koka. Thank you so much for being here. It's very important for us to have the support. Buba Bari, thank you, thank you, thank you. Let me move on to the next topic. Manina, can you check on your list also what we agreed to discuss?
Yeah,
Next.
I saw one that this is on the newspaper. I'm not sure which newspaper this is, but it was talking about police arrest over 100 for violating the curfew restrictions. I would have thought that people would have definitely stayed at home. You know, I think this is not getting through to most people, and I think the government needs to be more strict. I think $5,000 it is, and then what again I charge $10,000 plus possibly 3 days at mile two. I don't know because this is
I have a
serious.
question. Sorry, Dogumalade. I just have a question. Do you think that some of these youths that are unemployed as a result of the COVID-19 in the Gambia, they've lost the little jobs that they were doing, maybe in the tourism industry, you name it. Do you think that charging them $5,000 is something that makes sense, and it's something that will make them adhere to the rules and the measures uh, given by the authorities? Where are these young people going to get the money from? It's just a random question. I mean, I'm just trying to be very I'm just
I
trying to
think
be very pragmatic here.
no,
You charge
absolutely.
people $5,000, $10,000. Where are they going to get the money? Are you going to
Absolutely.
also fill up
I
the
understand.
prisons with young
I
people
understand
because
what
you
you're trying
found
to
them
say.
sitting in the streets? It's just a question. Try to give me an answer, please.
I totally understand what you are saying, but you need to also understand the seriousness of the situation. And I think sometimes you have to take drastic measures to put it through to people that this is serious. They understand that they don't have jobs at the moment. They understand the reason why they don't have these jobs at the moment. It is a serious situation that the government is trying to tackle. The government is trying to see what they can do. They're overwhelmed, so they don't need that extra whatever these people are doing. So if they charge them extra, yeah, dinañ toog seen kër yi bintu soo toogee nga xam ne yow amuloo $10,000 yi pour fay fi la téye te nga xam ne di nga dem tëddi mile two benn 3 days maa la wax ne kenn du nekk si mbedd bi kenn du fa nekka. They're not taking it seriously at all. They're not taking it seriously, and they need to take it seriously. This is not a time to think now because Gambia fu nekk ni ñu bari amuñ liggéey. It's not just the boys and the youths. Ñu bari amuñ liggéey. People are panicking. People are thinking how they're going to feed their children. And the quicker
Absolutely.
we take control of the situation, the better for everybody, the better for the economy. And that way, those kids or those boys and girls who think they could just go out in the streets, they would also get jobs. That's how their jobs are going to come back. So we need to tackle this situation. This is no time to think that Pate is not earning whatever, or Pate is or Fatmata is not earning whatever. It's not a time for that. This is a time to show people how serious this
I
is.
mean,
And
yeah,
I think that even the 10 a.m. bill, whatever, no. Then could have 7 to 7. From 7 p.m. to 7 a.m. Then could have 7 to 7. Then you talk and cute. Because the government is overwhelmed. This is not like a developed country like UK or America. This is a developing country. Then you have in Gambia, looking at the health system. So the
mhm.
government are overwhelmed. You're telling me 1025 is not working. Bispunek and you get target there. And these people think they can just roam about the streets like that? No. $10,000 plus new bula mile to 3 days. Tinga talk sakit. Bintu Kamara, Kendu Gina. There's no time
I,
for maslaha. Kendu Gina.
I, I agree with you. I agree with you. And that's why I'm saying that we need to be very pragmatic, solution oriented. When you're dealing with people that it is very difficult to put a message across to them for them to accept it and to digest it properly and apply it, what do? I think that giving the magnitude of the situation, we need to be smarter than some of these issues. And I think we need to rise above some of these issues and come up with pragmatic solutions. That's why I'm asking. It was just a plain question. Do you think that the fine that is going to be imposed on people not respecting the curfew is the actual solution to ensuring that some of this? Or do you think that maybe, for example, like some people are saying, the army should be in the streets? What do you think?
No. No. With the army in the streets, no. Then by anti-crime, and you definitely know that. Man personally, the army in the street is just gonna make things a bit nah. I'm totally against that. But I think that $5,000 and a threat of Yogula mile through. I think
Our yeah,
I think that
our
would
keen
scare them a
followers.
bit. They would say it would scare them a bit. They might not be able to pay. 3 days later, they'll come out. Do you think that same individual will come back out and go and miss the curfew? No, they won't. But the
Yeah,
thing is, you have to understand. Maybe that's not the type of thing that you would do here in the UK. But then I want to understand. You have
yeah,
to make something so extraordinarily serious for them to take it seriously too. You know,
absolutely.
for
I
them to
agree
take
with
it
you.
seriously too, because this is no joke. This is no joke, Bintu. All it takes is for one of those guys. Hinna hamna yo kena ko hamne mola watchmanal. Yo sa watchman bi ñew sa kër, and then yo hinna nga romba sa watchman bi mu infect. That's how the infection goes.
Yeah.
Understand? From person to
It goes
person.
very fast. Yeah, it's not a joke.
Understand?
I mean, it's not a joke. People need to be more
It's not a
responsible.
joke.
We have one of our followers here who is coming up with a solution. I mean, proposing something. It says, I'm against of that $5,000 C. I'm against that $5,000 C. At least they can do community work to cover up that 5,000 fine.
That $5,000, you know what that $5,000 can do if the government is going to use it right? The healthcare workers. It can go towards them. It can go towards their fares. It can go towards their food. It can go towards their PPEs. That $5,000 it would be their contribution for giving the health workers extra work to do. You
I
know,
mean, let's be realistic here for a minute. Let's be realistic. What is the profile of the people that are found uh, roaming the streets during curfew time? Do you realistically think that those are the people who can afford paying an amount of $5,000? I mean,
they're being
let's just
charged.
be realistic. They're being
They're being
charged,
charged, but
yes. Do
Bintu, nit ku nekk, this is how I see it. I understand where you're coming from. Totally understand. If this was a different situation, I'll be like, okay, that is a bit too much, yeah? But man, suma hamene man awma halisi pay $5,000. The man make sure they 9:30. Feka na masuma here. But they're not taking it seriously. It's not being taken seriously.
wow.
Understand nga fuma waheni?
Hmm,
Because the
hmm.
man man duma muna suma pay $5,000. It's obvious ne you're going to be called to the anti-crime and you're going to be in trouble and all that kind of thing. Why would you want to put yourself through that type of situation? You know,
Yeah.
I've seen a couple of videos. There's one video I saw of a couple, and the man was saying, "This is my wife" or whatever. He was intoxicated. So most of these people, he's not getting on them, nan or whatever they did or whatever, But what I'm
yeah.
saying is, Bintou Kamara, you cannot be a sober individual. Nga hamne nekuloo di liggéey. Yaa ngi try pour ut loy lekka pour just a family. You're going to be so irresponsible and stay out in the street so you can pay $5,000.
So,
Come on.
yeah, I mean, what do you think about the proposition of some community work? I mean,
That's
for
what
those
I mean.
people
Go
who
to mile two and you them dug some grass or do something. Then you go mile two, but just take them to the side of the road and say dug grass. They will do it again. It
I
needs to be
mean,
serious, Bintu. The punishment
mhm,
has to be serious as the disease that you're going to the virus that you're going to infect someone with.
absolutely.
And plus you're overwhelming a healthcare system, Bohamne. They're not
It's
coping.
already
They're not
saturated.
coping
Yes,
at all. So
it's already
in
saturated.
normal circumstances, and then hey, amun halis. Why nyom neka nañ di halat ne? It can be somebody's parent that might get infected and die.
Yeah,
Ñaata nit ñoo nekk di dee Gambia. So sorry to say, but for me personally, my empathy would be towards those people who are being infected and those people who are dying. My empathy would never be towards the people who are being irresponsible.
yeah. You have Amadou Skatrejane, who is also saying that he's fine with the option of community service.
Thank
I mean,
you.
if the I mean, if the authorities are
Thank
watching, I'm
you.
sure this might give them ideas. And I mean, this is it. We need to do what we need to do to protect the country and to
Yes.
raise awareness and to make sure, because the idea is to
Me
get
too.
people to become
They can just give
conscious of the
they can just give
situation.
a ridiculous amount. Hey, then you need 20,000. Obviously, they wouldn't go fake. Why could they alone? Don't get in a bintu. I'm telling you,
Why?
20,000 at them jail. Can do get in a- I'm telling you, they're not taking. You can see when they stop them. You can see that these people are not taking it seriously at all. They're not taking it
Mhm.
seriously. So it's a sad
Yeah.
thing, but moi lolo. Like I said, let us all take individual responsibility. That is very
Sure, of
important.
course. I mean, that's the bottom line. That is the bottom line. And Charles is coming again saying that he doesn't agree with you regarding the $5,000. He's thinking that it's a lot of money, and he knows COVID-19 is real and deadly, and there was a fund allocated for the Ministry of Health. I don't really know what he means by that. The fund allocated for the Ministry of Health, does that mean that? I mean, this is
Charles,
two different.
if
Yes.
this was a different situation, Charles, I would have absolutely agreed with you. But we're gonna have to agree to disagree. I think that 20,000, so we go ahead, I want to call it. It's just to deter them from doing it. They're not gonna be able to pay it, obviously not. Why understand that if you're a parent and you know your kid is going out, or you know your sister, brother, or husband, or whatever, now go like 20,000 or 5,000 before you would
Hmm.
stop them from doing it. I
Yep.
think the fee is right, 5,000 yeah, then ko pa buy. But then for your 3 days at mile two or something. I don't know. It's just well, it's not like there's a lot of people. Well, 100 in this case. That is the
Yes.
Luma just read out, but it is
Mm,
it is sad though that it's not being taken seriously,
I
and
know.
something
I
needs
mean,
to be done more drastic. And then 7 to 7 instead of 10 p.m. but 7 is it 10 p.m. but 6 a.m. or 7 a.m.? I don't even know.
six,
What's the time again? The curfew 10 p.m.
10
but
to 5 a.m., I think.
10 to 5 Okay, there you go.
Okay, so now just to move on to another topic, after this topic of the curfew, the respect of the curfew, and all the other measures that the government has issued, we have Marilyn Pendergrast, one of our followers also, who is coming back with a question. Apparently, she had put this question across before.
Mm.
We might not have answered. Do you want to go ahead with reading the question, Manya?
It says, I have suggested that someone set up a GoFundMe page. This way, the money donated would go directly to frontline workers and not the government. It could help pay salaries and urgent PPE when money is not coming from the top like it should be. Just a thought. I can just say, Marilyn, that there are a lot of GoFundmes that are happening at the moment. I saw one that was to do with the feeding, their food, and that sort of thing. So yeah, loads of Gambians, especially in the diaspora, are doing GoFundmes to do that because obviously. as we've realized, we can't all depend totally on, the government. Not that they're not doing what they're supposed to do, but they're overwhelmed too. So anything that we can do as Gambians as well, individually or as a group or GoFundMe's, we will do that just to help them out as well. And with regards to that as well, there is a woman, she's a nurse, I think she's a healthcare practitioner. Um, Her name is Ifinyasi. Ifinyasi has been doing a lot live videos. I think she has this organization that she does, GDHI, but she does live videos and she explains a lot about telling people about how to wear their mask and just having discussions like we are now. And I think yesterday I was watching and they mentioned something about getting Gambians that are healthcare workers or health practitioners, nurses, doctors, or whatever, to come together and then try and go to Gambia and help out. So she's doing that. She's trying to get people together. So today you're out there and you're a Gambian and you've got experience in the healthcare. You can always get in touch with Ipinyasi because they are looking to get Gambian nurses or whoever, even if you're not Gambian, and then try and go back to Gambia and see what they can do. They are going to obviously get the government involved and see what they say as well, collaborate with them. So loads of initiatives are going on, Marilyn.
Indeed, indeed, indeed. There's lots of private initiatives that are going on, and this is something that we must commend because it shows that at least people are really concerned and want to contribute towards the fight of this COVID-19 in the country and not leave everything to the government to handle. We are aware of the lack of capacity of the government in certain area, and we need to step up to take care of ourselves, to take care of our needs, to take care of whatever needs to be done and not wait for anyone to come to our rescue. This is a matter that has gone almost worldwide, I want to say. So we cannot just wait to get any help from somewhere before the help comes from anywhere. It has to come from within. And I commend all the private actions that are going on. And
Absolutely.
one word of advice that I would have to all these private initiatives that are going on, like we say, molo mwe dole. Let's try to unite in order to merge all our different activities and make it one big activity that will benefit the population. I think that this is the only way some of these initiatives can have a meaningful impact. And I think that COVID Gambia is always open to the public for ideas or for any initiative that would be potentially want to come towards the initiative, so that we make it one and move together towards one common goal, which is fighting the COVID-19 in our country. Do you have anything else to add, my dear?
Also, you forgot to add the initiative that COVID Gambia is doing with regards to the masks. You guys are producing it in bulk. I think you should advise on that because I did see a video as well of this woman who was explaining how the masks are being produced. So you can be a tailor and piece to death, and you decide to just take that and start selling masks. And the way how people are selling masks randomly on the streets, and I think that needs to be regulated as well. I think that woman, she did put across some really valid points that
Yeah.
needs to be looked at. And also, I think if I've not got this wrong, but when you guys started, you did have someone from the Red Cross came, and then they saw your place. Everybody that comes to your factory, they're very well impressed. And I think people should be very responsible. This is not about making money at this moment in time. This is about saving lives. And if you decide to take that initiative and want to make masks, make sure you're making it responsibly. Like Yen Nolan for the fair, you've got that distance, social distancing at your factory. They're wearing masks. Everything is regulated properly. And I
Of
think
course.
we need to be very, very careful with that, you know.
Absolutely.
But again,
Absolutely.
I agree with you as well with regards to us coming together and just becoming one big instead of having
Entity
little,
or one.
yeah, yeah. But the thing is, that's how we do it as Gambians. It might be fortunate or unfortunate, but I think that sometimes when somebody sees something, they feel like they need to do something quickly, and they don't have that time to wait to have the discussions and all that type of thing. But yeah, I think that's a good idea to always come together as one. And I think we're more powerful when we're united, aren't we? When we come together as one powerful force.
Yeah, absolutely. We agree with you, Chadra Megalot, and thank you for your message. It's definitely true what you're saying. You thanking us and saying that unity is crucial. Singling out contribution may not be the right route to fighting COVID-19 in Gambia, and definitely, I mean, we totally agree with you, and that's why we have our doors always open to welcome anybody that has also. Who also have an initiative going on and would want to either join us or to benefit from some of the things that we are doing also. And this is how it should be. This is not an individual fight. This should be a collective one. And we hope that it's going to be, there will be more and more actions united, unified going forward. And
Absolutely.
if I should throw two words regarding the mask issue, yes, I mean, as a reminder to our followers regarding the mask issue, COVID Gambia has set up a mask production center in Aizamari Cinema. It's a sort of factory producing masks. We have a group of about 20 or more tailors producing masks on daily basis for a couple of months now. So we have the capacity to produce a quantity of masks. It started as a humanitarian gesture with masks being produced with the aim to distribute them up country and to other areas where the Red Cross, our main partner, would be one of our main partners, sorry, would be identifying vulnerable areas and vulnerable people or people who really need this mask because of the nature of their job. So this is how we started to do donation to the Red Cross, and the Red Cross started distributing them around. But then to be able to sustain the initiative and continue to be able to pay these tailors, we just decided to commercialize the mask a little bit because it was beginning a bit it was becoming a bit difficult financially for us to sustain it on our own, since it was self-funded out of our own pockets. So now the masks are being sold around at a reasonable rate, and we have different options. So it's also important, if you want to support, all the information are on our Facebook page right here. You can always access them, and or eventually contact us on the number that is stated on our Facebook page, and we would give you more information, and you can also place your order online with the delivery option and everything else. Yep. Now we move on to another topic. I think the time is almost up, but then the
Yep.
conversation is so interesting that we don't actually realize that time is moving very fast. As part of Yes, as part of the actions that are happening in the country, we came across the information that there are about 100 beds about to be fitted at the stadium for COVID-19 treatment. Apparently, it's a joint partnership between line ministries for the construction of tents. The initiative is initiated by Mr. Panjai Girigara. So I think that, Manya, you can say a bit more about this situation than I do. So I'll
Yeah,
leave.
when I heard that, it was welcoming news because obviously I think RVTH has been exhausted with regards to the patients and those with COVID-19 that would go there for emergencies and that sort of thing. So to have something like that at the Independence Stadium is absolutely welcoming news. But I do hope that it will be well equipped and obviously well regulated. Yes, you can have a beautiful white elephant, but we need to make sure that what is supposed to be in there is in there. But yeah, it is that when I heard that, I was so happy because my concern was when patients, they've got underlying issues, let's say diabetes, heart disease, cancer, or whatever, they're going to RBTH. how are they trying to isolate these people from those people who are infected with the COVID-19? Because RETH is not that big, understand that. So at least now they can try and divert not parents, patients to whatever that is that they're going to build. Yes, I've heard that they're using tents and that sort of thing, but how they intend to use it, I don't know. Are they going to have patients being there, or are they going to isolate people? I don't. Naka like ko guy plan for defa.
I mean, joxe details yooyu, but it's supposed to be a treatment center. That's all we know. Now, how they're going to go
In
about the
tents, how
technical.
are they going to do it in the tents? I don't know. I don't know. But how are they going to do it? So let's say, for instance, if you're infected, they take you there to get treated. Is that what it is? That's what the tents are for.
I
You
guess
see,
since we're talking about hospitals being congested, health
yeah.
centers, some clinics
No,
closing, I
they
mean,
did. I
there
know,
has
but
to be some alternative solutions, I guess, and this
yeah,
is
in the
one of it. I
interim,
don't
how
know
they do
how.
it.
Yeah, I don't know how they intend to go about it, and what is the technical aspect that they've envisaged towards it. But I want to believe that it was well thought of, and that it's going to be effective. There's a Chad Drame Diallo who's coming up with a question saying that the stadium in a residential area, is that a good idea? The virus isn't standing in one place.
Oh yes, so
So
Chad, what's
he has a concern,
yeah,
I mean,
that
about
that is a good point. Lord Hamane, I don't know how they're going to utilize it, what they're going to do, how they're going to do it. I don't know. They haven't said that. They've just said they're creating a space where they can.
Mhm.
Is it to test? Because Manhamnane, when I saw tents around here, it was to test people. So you go in, they have a way of doing it, and then you Tesla, and then if you've got it, they'll either tell you to go and isolate. Because fee, when you've got it straight away, they don't take you in. The hospitals don't take you in. Even the ambulance will not come and take you. The way it works is you've got it, you have to wait. If your symptoms get worse to the point where you cannot breathe and you can't take it anymore, you call the ambulance and they come and get you and take you to the hospital. So usually some people don't even have to go to the hospital. They just isolate themselves, do what they need to do, and at some point definitely they buy and they get better. Some people the breathing gets worse and they have to go into the hospital. So I'm not sure how they're going to utilize that space, but I know, like I said, they need to make sure that they're doing it the way they should be doing it. They do it really, because like Chad said, yeah, there are concerns with regards to, yeah, it's a residential area, but regardless, I'm not in class fee, they're around residential areas. Why is the ministry will at desk, metal regulated people that are going in and out of it, and what they're gonna use it for, what they're gonna use the space for. We know it's going to be COVID related, but how are they going to utilize that space? That's the thing.
Yeah. Okay. Well, I hope that answers your question, Chadrame Diallo. Uh, we'll move on to another.
I guess that answers her question. She's just sent some hearts, Bintou.
Okay, that's good to know. You have the UNDP also via their Twitter account, who are also sending preventive measure messages to the public, and obviously asking the public to be very cautious and to really pay attention to symptoms that one might be feeling at some point. Whenever you feel certain symptoms that you do not really understand, it's important to try to verify what that is and speak to a health professional via the number that has been issued by the government. If you feel that it might be COVID-19 through the symptoms that you've heard that are related to the COVID-19, do not try to take a public vehicle to go to any health center, self-isolate and look for help. I think that's all what we can say, even though people are coming up saying that the 1025 number is not working, and some of them come back to us to tell us that you are asking us to self-isolate and call the 1025 number, but it's not working. But I'm sure that the government is really taking that into account and reinforcing whatever work they've been doing toward reinstating that 1025 number and ensuring that it is fully operational, because this is really a number that the general public rely on in case of anything. So
Yeah.
that's all we can say in that sense. Yeah.
Yeah, absolutely. And also, Bintu, whilst you were saying that, the thing that came to mind is most of these things that they're saying, I feel like it's more to do with people who live in the urban areas.
Absolutely.
And even though with people who live in the urban areas as well, sometimes you will find these situations whereby I come from a poor family, either in the urban area or rural area. And I am in a household of 13 people and we live in a two-bedroom house. How does the government expect me to isolate? How do I isolate? That
That's a
is
very good
that is
question.
something I think we focus too much on the urban areas. We focus on the Banjus, the Serakundas, the Sukutas, and all those Brusubis, those areas, Pipeline, Fajara. And I feel like if you're going a past Brikama, the them. Understand? Let's see rural areas. See what is happening in Basse, what is happening in Georgetown, what is happening where my dad comes from, Boraba, what is happening in those areas? How
What's
are those
happening in
people being
Badibu, you know?
sensitized? Are those people using masks? Because we've seen in the when the Tobaski feast came, people were saying they were going up to go and visit family members, and it's the people in the urban areas that are taking it back there. So
That's right.
we know the figures. That's why in the beginning I was saying it's good for us to know what the figures are. Where is it focused on? Are we talking about there's 500 people in Banjul that have got it? There's two in Brusubi. There's three in this place. What about Basse? What about Soma? What about all these other areas? We need to know what is going on. We need to know what is happening, because also Gambia, we've got very poor man. Those are the people that it breaks my heart. It breaks my
Mm-hmm.
heart when I think about those individuals,
Mm-hmm.
because some of them don't even have the phone. 1025, they don't even know that it exists. How are we sensitizing those people? Apart from depending on people that are in the diaspora that have family members that live in those areas, what are we doing? Not to sensitize those people, and I'm talking to the ministry. What are they doing to get further into those areas and let these people know that this is what's happening and this is what you need to do?
Absolutely. I,
You
I,
know,
I I agree with you. I
we
mean,
need to do that. Those people are being isolated. We're too focused in what is happening in the Combo areas, and we're not focusing in what is happening in those areas. How are the hospitals coping? And also, some of these individuals, then your symptoms, you probably malaria because it's so similar to
mhm,
malaria.
absolutely.
Understand that? I think the sensitization is just not what we're doing now, because most of what we're saying is in English. There's somebody who understands only Fula. There's somebody who understands only Jola. How are
Well,
they? What else is being done to get to those people? Don't
I
tell
mean,
me TRTS, because now electricity is yalla rekaham. There's some of these people live in areas where they don't even have electricity.
well,
Then
Lul
what?
Mundagala,
How are we getting
definitely.
to
I
those
mean,
individuals?
that's a very good question, and that should be a high cause of concern, because Gambia is not only about the combos. Gambia is not only about the Fajaras
Exactly.
and the Pakau and the Brikamas and the Brusubi and so on and so forth. Gambia is bigger than that. So some of those areas should also have high consideration in this fight
Absolutely.
against the COVID-19. As a matter of fact, yesterday I received an information coming from the Jara area. Apparently, there was an audio circulating. It was from one health worker in one of the health center in Soma, in Jara Soma, I want to believe. He apparently, the health center or the hospital in Jara Soma was closed. They were about to fumigate because some nurses tested positive there. I'm yet to confirm that information, but it's coming from a source who is working in the hospital in Jarasoma. It might be the health center of the other hospital. I'm not quite sure, but this was the information that I came across yesterday evening. So if that's the case, then us in the Combos here, we're not really told what's going on up country. And we know that our testing is limited to the urban area, to the greater Banjul area. So what is the real situation of COVID-19 in the Gambia as we speak? Can anyone answer that question? I doubt it. So I think it's fair enough to say that we are in an alarming situation as it is, because if we do not at this stage have the capacity to test massively when we know that community transmission is going rampant, I think that we can say that yes, the situation is quite alarming.
It is.
Yes, Marilyn, thank you for your answer. You telling us that our program is very informative and helpful. The tent in the stadium is going to be a bit like a field hospital. These are frequent with the army. The British Army always has a field hospital to treat casualties where needed. That's true. Yes, it looks like the military hospitals in sorts of tents. Yes, this is how it looks like according to the pictures that we've seen circulating on social media. This is exactly how it looks like. Yes.
Yeah.
What's happening in
Well,
Koina, Nana
I'm
Danso? I
surprised
mean,
that
it's
we
a
felt restricted.
$1 million question. We do not know what's happening in Koina, like we do not know what's happening in Jara, in Basse, in Badibu, in Kiang. We do not know. I mean, you know, the Kiankas don't believe in COVID-19. In fact, I mean, it's a big
But
challenge for some
do you
of
know
us
how we would know
to.
if the figures reflected what areas have what? We would definitely know. The figures need to reflect that. And but
Yeah.
the thing is, it's 2 days later. So soon you're honest, I don't have figures. You get coin a full moon, your lot, and you am that 2 day delay. Then that makes sense. But unfortunately, that's not the case. You
Yeah.
know. But
And
I
another.
think the initiative that other people that are doing, like the Ifinyasis, when I heard that, I was like, yes, you guys go and do your thing. Your nation needs you. Go and help out and give the experience, because these people are, like, as we speak, dealing with patients that have the virus. So they might be able to take, the experience that they have and go and share it with our healthcare workers who are doing amazingly well as well, might I add.
I mean, yeah, yeah, definitely. I mean, we never, never, never cease to throw comments about these frontline workers, health workers. Without them, I don't know what the situation of this country would be. They're putting their life on the line. They're constantly on the ground trying to save lives, trying to bring in relief to those who are in distress. And this is really commendable. They are really doing an amazing job. And we always make it a point of duty to mention it during our live programs.
You
A
know what
big
I
shout
was
out.
thinking, Bintou? People like yourself who are in Gambia, because here in the UK, every Thursday we go out and we clap for the healthcare workers. Maybe an initiative, something must be done to show these people that we really appreciate them. I don't know how it's going to be done, but I'm sure there is somebody, a smart individual out there, that might think of something that we can do for the healthcare workers to celebrate them, so they know that at a certain day, a certain time, it's all about them. It's us saying to them, you are our heroes. We thank you so much for what you've done, and we
Yes.
salute you. They
I,
need
I
it's
agree
just
with
a
you. That
moral boost as
recognition,
well.
yeah, moral
Yeah,
boost and a
it's a moral
recognition.
boost, because
Yes,
going to
definitely.
war without without everything that you need is tough, because these people are going to war. That's how I see it. You
Yep.
know, so we need to boost their morale as well, and just let them know that we
Definitely.
salute
I
them.
doubt that the clapping would really be adapted to our culture here, and that it will really make an
Oh, we can
impact.
come up with
In the,
something
no, no, but
different.
I'm
Like I
just saying,
said,
I'm just saying this. I mean, just to crack a joke and to ease the
yeah,
atmosphere a
yeah,
little
yeah.
bit. But
Feeling your
you're
tattoo.
absolutely right. Huh? Ah,
Gambia, kundi dapat
tachu,
dapat.
right? Why?
Listen mo kita
Did
ninyo
it?
tattoo. Senyor dapat
They,
ninyo
they, they,
tattoo. Yun kundi dapat dapat am.
Tachu mom, mom,
Huh?
no, no, no. I don't think that's the solution, man. Tachu mom,
Find
nyo
something.
lenen.
Find something. Find a day and call it Healthcare Day.
Yeah,
I don't know. Some, like I said, there might be somebody watching who has a great idea that we can just put out there. We can even do it on social media, because most of these healthcare workers are on social media as well. So
Yeah,
I
well,
think we
suñ
need
nekkee
to do
delegate tamit, I
something.
don't think they'll have time to. I mean, yeah, I mean, I think that there should be something concrete done to them, and a day where they're going to be celebrated with some concrete actions.
They
And
don't need to stop what they're doing. They have to continue the work. We are just going to
yes,
celebrate them. They need to
no,
continue
but
the work because we need them there. But yeah, healthcare workers in Gambia, we ñu ngi leen di salute. Abarka bake, abarka, abarka, abarka.
lopitan do kulal ala baraka bake ala baraka albe do ku men nga kalamuta do ku kolearim balem bal tentulam bal jeila. I mean, this is something that we can say in
Yep,
every language and share it in every social
yep.
media, every WhatsApp group, every, there should be a message of support to all the healthcare workers and all the frontline workers throughout the country, and make sure that it reaches them. It's very important. You're
Cleaners
very
in the
right.
hospitals, the people in the morgues, all of them, all of them.
Yeah, absolutely. And to bounce back on the issue of these frontline workers, we've seen a tweet from Alassane Senghor. I think it was tweeted yesterday, and it says that burial team was refused to board the ferry from Bara. This is no respect for humanity. These volunteers are sacrificing their lives. Let's recall that Alassane Senghor is the Secretary General of the Red Cross, Gambia Red Cross. They
Yes.
are doing an amazing job on the ground. They're the ones collecting bodies of dead bodies of people who have succumbed either to the
So did
COVID-19
they,
or succumbed at home. You know,
yeah, so the healthcare workers, did they go to take a body or something? Did they go to retrieve a body?
no, I think that's the role of the Red Cross
So
rather.
what did they, sorry, I mean the Red Cross. What did they go to do? Did they want to come onto the ferry with a body, or what was the
I
situation?
mean, it's not specified. I think that we might try to see from the journalists that are maybe going to interview Alassane Senghor or the Red Cross members about what
If
actually
if
transpired there. But all we saw is a tweet from Alassane Senghor, the Secretary
yeah,
General of the Red Cross, who usually does not put across this type of message. So I was
yeah,
a bit surprised to see this message
that he said,
on Twitter
yeah.
yesterday
I
saying,
think they should take priority, to be honest. Delay those people, individuals who are waiting for the ferry, and then there's a corpse or a dead body that they are trying to, I don't know. They should have given that body priority. Man, personally, that's what I feel, because you
I mean,
can't do that. Yeah, they
the
should have. They should have absolutely.
the Red Cross members are not just the Red Cross team is not only about people carrying this burial or collecting dead bodies. You also, I mean, it's a big
But
team.
why would
They
they
divide.
allow them on the ferry? Man, I don't understand. Unless they, because why wouldn't they allow them on the ferry?
I don't know. I mean, we can't speculate because we don't have the facts, and we always
Yeah,
try to put across verified and reliable information on this platform. So we're not going to speculate, but we just wanted to mention the fact that we saw this tweet around yesterday, and that
yeah,
it really puzzled us as to the reason why this would happen, knowing the role that the Red Cross volunteers are playing in the society. They're going, I mean, the team of the Red Cross teams are scattered throughout the countries, and they all have a mandate and a role to play. Some of them do sensitization. Some of them, I mean, they're playing a very vital role in this fight against the COVID-19. They are trained in emergency preparedness and response. So they are really the reliable people that we can trust when it comes to sharing vital information, sensitizing the population, and also carrying out certain type of sensitive operations. So I think that's something that people should know. And if the people at the ferry terminal in Banjul are not aware of who the Red Cross is or what the mandate of the Red Cross is, I think it's very important to let them know. And those people, we believe, should have the priority when it comes to boarding the ferry, because they're always uh, in a state of emergency preparedness and response. So they have a very crucial role to play, either around the urban area or the rural area. So this tweet really puzzled us, but we will try to know more about it.
about
Really, I
it.
think
Yeah, yeah.
it's really necessary.
I was just thinking, well, why would they not let them? Why would they not let them board the ferry? It's just, yeah, Gambia for you.
What else? Yes, so we're done with the. Yes, we've seen also a tweet from Dr. Keba Marena. I can read the tweet. It says, "It's unfortunate, but I have decided to stop all my private clinics operation until September. Hopefully, for the safety of the patients, staff, and myself, I will still deal with emergencies, mostly fractures, as the needs arises. Apologies for the inconvenience I know it will cause." So Dr. Marena, I think, is a surgeon and orthopedist, if I'm not mistaken.
Yeah.
Yes. Yes, so the fact that he is ceasing operation in, I suppose, his private clinic is going to be a bit of an inconvenience, knowing that there's not many surgeon and orthopedists in the country, and he's quite famous. His name is around a lot, which means that he must be a very good one. The fact that he's ceasing his operation, we believe, might be related to COVID-19. Infection going around with this community transmission. Nobody feels safe. So this is one more disappointing news that we are receiving, and we fully understand, obviously, but it's important for the public to have the information about Dr. Marena.
Yeah. So you see, this is the thing. Like, he's shutting his clinic because of reasons he hasn't stated, but he
Mhm.
has said that he's going to see emergency patients for fractures only. So yes, obviously, if he shuts his clinic, he is on. Well, I'm not saying he is. He's not gonna be. I don't want to call him unemployed, because it takes me back to my point I was trying to make with those people that are going out there and not respecting the curfew, and we think the $5,000 is too much and they're not employed and whatever. I'm going back to that, but the point I'm trying to make, look, this structure too is affected because of the COVID situation. So we need to get the COVID
Mhm.
situation sorted again so we can get our economy back. Our economy was struggling as it was, as you know. So we cannot have people breaking the curfew. We cannot have people being irresponsible, because what you've taken there now is a doctor that people would definitely need, who don't have COVID but have other illnesses that needs to be catered for. They won't have that anymore. So we need to be responsible. That's an example right there. We need to be responsible. Tog len sen piryi. Toog leen seen kër yi, bu leen génna.
I'll
You
see
know,
su
only
okono
come
ali
out when you
sabati.
have to.
Mhm.
Go find food and go back to your house, because there aren't any jobs. And if you stand there, who are you going to go and find work from at this moment? Because the person you want to go and find work from is also suffering. Hotels are closed at the moment. They're not operating. The tourist season is drastically, it's non-existent at the moment. So we need to get together and make sure that you fight Lee, them, then we can get our freedom back.
Yeah, Manina, thank you
As
so
long as
much.
this is there, we won't, yeah. May lolo dahil.
No, I think our hip degalada. This is it. People have to realize that the
It's a
sooner
ripple
we
effect.
abide to the rules and regulation, without even the government telling us, we should know that as far as the COVID-19 has been revealed being in our midst, we have to know that it's about us, about our life and about our survival. Therefore, our survival depends on how well we handle this situation and how well we abide by the rules, because our survival, of obviously economic survival, will depend on how quickly the sectors, all the prominent sectors of the Gambia, are back in a full operation, so that
Exactly.
people get back to work. But the longer this situation drags, the longer it will take before anything can restart. Uh, and there's lots of jobs that are already being lost, especially the tourism sector. It's been greatly affected. It's almost non-existent in this
It
country
is.
anymore. And this is a sector that was employing a high number of young people. And
Yeah.
I mean, it's such a sad situation,
And
such
these
a sad
are the
state of
young
affairs
people
as we
who are
speak.
breaking the rules.
I
These
mean,
are the
we don't generalize. We don't generalize.
these are
There's
well, most of the video. Ban magnet gis
Why
nga
better?
TikTok
Why
video.
don't you generalize? Because so far, I think that
Have you
there's
seen the
been a
videos?
handful of people. I have, but there's been a
So
handful of
ban
people.
si magi nga fagis, the majority are what? It's the videos that we've seen. This is not part of generalizing, but the majority of what we've seen are young people. That's the fact. That's what we've seen. Those are the people. Gisuloo fa ben mak, gisuloo fa ben halel, gisuloo fa ben teenager.
Why, Bete, we'll put that on the account of ignorance,
And talk less and
and
Kerry. Bintou is being nice. I'm saying
no,
talk less and Kerry.
I'm not being nice, but I mean, all I want to say is that let's just let's
I've been
just
good.
not generalize and try to
I've
encourage
been
the
good.
young people to respect these measures. It's new for
Bintou, you know what
everybody,
it
and
feels like? You know how what it feels like, and it's so frustrating. I feel like we're all in this boat, and there are some people who are rowing and rowing, trying to get to the destination, and then you've got other people that are drilling holes. We know who the people that are drilling holes. The ones that are not social distancing, the ones that are not washing their hands, the ones that are not taking these things seriously. And we all need to be rowing. We all need to be rowing if we want to get to the destination. So it's
yeah,
frustrating. You
I
can't
mean,
have, like you said, unify. We all have to unify. This is an illness, a virus for Hamne. If we don't unify, we're doomed. It's as
one
simple
last
as that.
word in Wolof Mania, because it's a bit too late now to do a version in local language. So if you had to summarize quickly, what would you say? But just say it in Wolof or in Mandinka, whatever.
Man luma am pour summarize mooy ne ñun ñëpp ñoo nekk ci gaal gi te ci gaal googu leen suñu amee ñoo xam ne ñu ngi roo am ñoo xam ne ñu ngi buna gaal bi su dee yow doo dee raxas sa loxo yow nekkuloo di isolate yow lépp loo xam ne government bi ñoo wax ne moom nga war a def nekkuloo di ko def yow ci ñuy buna gaal bi nga bokka te fu mu nekk nii ñun ñu ngi try pour génn si problème bi because dangaa gis ne ñu bari liggéeyatuñ tourist industry boo xam ne dañ ci depend ba nga xam ne xale yu ndaw yu bari yoo xam ne ñoom si loolu lañ depend liggéeyatuñ so foog corona génn si dëkk bi ndax ñu mun a amaat suñ économie bi so soo leen ko xoolee noonu den ngeen toog seen kër yi ngeen raxas seen loxo yi ngeen dimbale government bi because fu mu nekk nii government bi tamit yëpp yi daf leen uppa doole ñu ngi try pour def luñ mun waaye foog ñu ni tamit ñu jël suñu responsibility foog ñu ni tamit ñu try ñu def lu ñu war toog leen seen kër yi toog leen seen kër yi stay at home. You've got nothing to do outside from 10 a.m. from 10 p.m. to 5 a.m. Toog leen seen kër yi. If you don't have anything to, you see, I'm going into English again, Bintou. So my thing
All of
is,
lengua.
the guy talks seen kër yi daal. ñun ñëpp ñoo nekk ci lii su benn nit feebaree keneen dafa feebar. Bintou
Very
Kamara
important.
naa nekk sa watchman su feebaree there's a chance ne yow itamit di nga ko am.
Definitely.
So we're all in this together. yow itamit su yaa ngi feebar sa biir néeg nga am dinaan bi mu ñëw mu clean mun na koo yóbbu ma métti. So ñun ñëpp a nekk ci biir lii te ñun ñëpp dañ war a dimbalante ñun ñëpp dañ war a jàngalante te soo gisee koo xam ne nekkul di def lu ko war bu ko yuuxu bu ko xas lii du yëfi yuuxu ak xaste lii yëfi pour ñu jàngal nga won sa morom naka la loolu la. We are all in this together ñun ñëpp a nekk ci biir lii te nañ ñaan yàlla musal ñu mun cee génna balaa at bi di jeex ndax ñu mun na ñëw December ñu ñëw holiday.
December amateurs, I'm telling you. Okay, but anyway, Maninya, like you've said your last word, I want to say in Wolof. I'll just have a last word in Mandinka also for the benefit of the Mandinka listeners. Mbebe kulunkilinne, nyinkuo nying abedameng alafta siala mol kungatile, mbedamente njahalo be kerinne. Ñing courant aɓe janjan kan sate o kono la janjanta sate o kono la aɓe fannal men na be man koye mol ma sa men ñanta kela bankudiŋo bankudimɓe Gambia ja ñanta men kela wala ñinti ye fantanka ni ye fantanka si keɓe moɗo tankandilale sa mol ñanta men kela wala ñinti ko kuma kongol men fota man sakunda e mol yamar men na wala ñinti bulukuwol ni ñing ka fata bengol ma anin ye ku jamal sarti jamal landi mol ñanta wala tamandila men keta comme maskol ni be fintila kal masko dum ni be bulala moto kono transport kono kal masko dum ni tambita police station police checkpoint wala ka kal masko wura ni amera ko ka police wolle nene ike fon le nene ka to ni mo sitara no moto kono le me alon ko covid balale ite ko ye police wolle nene yela masko bondi aya tara ini membe moto kono afela ay soundi covid la so nyin ko so nyin ko nyanta kala hakil tu quality mo be nyanta lon nale ko mo man tanka nyin kuola nyin kuranga be damen amam mo jibe amam president jibe amam dindin jibe amam keba jibe nga jela ko sa nga minister jel la kumo mo e Gambia jamen yalon ko ye kuranga nyin sotole nga mo kumma mo be la kumma ya tabari mo kumma mentol ka fo bake nga mo kumma jelle mo men yalon ko nga mo ko nyin kuranga e male dolbe je men yalon ko niol tuta jele so isalon ko nyin kuranga amam mo jibe amam si jibe amam dine jibe amang fankamani fuare jibe mbela ba kono mbebe kulun kilingola kono nga kata masakunda e sartul men landi nga tamandi anyama nga fata suto finto nga fata mai ko kofiule be kering ali nga sabati nga kofiu ni respect wala ka botalantan suto la kata fo fajaro talan lulu nyol ma fon la wotu mole mol ala ta ka finti ko tenke so ali nga wokuol muta nga kata nga tamanda nyama isaji ko nyin kura nga sibonna banko kan kata bake isaji to fanan na tama ko nin na nyanto anin na do ko men yalon ko jamal fota ala le isaji isi murno do kudla dulal men sorota soronta isi yeleno ko tenke mol men yalon ko be siri fote la do ko la isi muru ye la do kudla wala ye kudo muta ebe kodo no la dame yela dimba al balundi so nyin ko ninga kele katabake ay bon kono katabake bajalal konna economy finance sembo soto no wala nyama ko tenke kata be dame economy ni aboytale ku jama be jele me alon kun ka keno kunum bimbu ka keno andu mu mo jamal la kasaroti ali nga kata nga nyin ko kele nga nyomuta nga nyoya mar ku kendola nga courant nyi mbay na banko kam
abaraka ina de amoni nyata ba
abaraka
ya bela fo Bintou ya bela fo
nka traele yalong nyin ko nyin dia mole fonga dia mole nga kibaro nyin sindi molma amang dia mo man dia bari nka katale doron katu kumol buka kumo fo man easy bari fonga katale doron ya english kan wala mandinka wolof fula in all the languages in safo no men nga fo isa kibaro si janjanga eta dula jangoto si mol bema yeah. So okay, guys, it's late. It's been an hour, 32 minutes and 5 seconds of live. I hope that it was informative, and I hope that you will join us. Maybe not tomorrow, but day after, because we try to come on live at least every 2 days to be able to have. The time to gather enough relevant information and then come and present to you for at least an hour or a little bit more than that. In different languages if possible, whereas it's possible we can do it in different languages if time allows. So this is what we had to present for today. I hope that you got to learn a thing or two and that you will also spread the message and share the message with your people also. Thank you for following us and thank you for being part of this live tonight. Bye.
Thank you for having me. Thank you for having me. And thank you, listeners. Good night, everybody. Stay safe and social distance. Wear your mask and wash your hands.